Hi, everybody.
Hello.
I don't know what time it is, so I need someone to be my timekeeper so I don't go over. My name is Amy Yeager. I'm the Health Education Director at the Madison County Health Department. As Mr. Eaton said, we are located in the old Wood River Hospital. If people wonder what's there, it's us and a lot of other county agencies. We always kind of joke that that's the kind of people outreach building because we're in there, child advocacy is in there, the morgue's in there, the sheriff has a substation there, LIHEAP, which is the energy assistance, is there, employment and training is there, the emergency management has, well, they're all over the county, but there's a lot of different people that are in that building that do a lot of the direct service in the community. So that old hospital is being put to good use with some direct services to people. So when I got the call from Joe to come and speak, we talked about, the health department does so many different things. What did you really want me to talk about? And we decided to focus more on what is the health department and what do we have to do. And if there's something specific that you're interested in, we'll be glad to come. I can send someone from one of our other departments to talk about something specific that you may have an interest in the future, because I understand that you meet quite often. So I do have some brochures and some handouts here for you that I'll pass around. But the health department was established in 1996. In 1994, there was a resolution passed by the county board to have a health department, and it took till 96 to get all the state paperwork done and become a certified local health department. So we just celebrated 15 years this past June. We are the largest county outside of Chicago and the collar counties, and we are one of the last counties in the state to get a health department, which is a little crazy. Not sure why, but we found a lot of history and newspaper clippings from the last 100 years of people trying to get a health department. So we're just very grateful to have it and to be here to help serve our citizens here in the county. There's two ways that a health department can exist. You either can have an independent board, which by regulation has to have 5 members, 3 of which are at least a physician, a nurse, and a dentist. The other way is that your board can be your county board. Your board of health can be your county board, which is what our county is. We're only one of 2 in the state of Illinois that are set up like this. Us in Kane County, our county board is our board of health. So your 29 elected officials technically run the health department. That's who we actually answer to, are them. But because the county board doesn't, elected officials don't usually have health background, there's a health advisory committee that's part of the statute requirement to have at least 5 members, which our county board signed an individual ordinance for Madison County that ours will have 10 members, of which will include a physician, a dentist, and a nurse to fulfill that. And so those 2 groups work together to advance the health in the county, from the policy aspect of it, as well as from the health aspect of it. It actually works very, very well. I think we're fortunate. A lot of counties kind of go, ooh, how does that work? And from hearing other counties, it works really, really well, because we have the ear of the politician all the time, because we're part of them, they're part of us, we're all part of the county. So it works really well. A lot of people don't know what public health is. They get confused by health care or the hospital system. Hospitals and physicians are the treatment end of things. We're the prevention end of things. And public health is primary prevention from the public aspect. Our job is to monitor and to try to promote and assure the best interest for the majority in the public. So whether it's vaccinations or education or environmental issues, making sure your food's safe, planning for a disaster, things like that, that's our job, is to help assure that those kind of things are done. The health department does not have to do everything. We have to just make sure that if there's a problem that's identified, we find who in the community can help advance that problem to a solution to make it better for people. There's 3 core functions of public health. It's assurance, policy development, and assessment. So at our health department, we base lots of decisions from any of our divisions on assurance, policy development, and assessment. And if we ask ourselves those 3 and it doesn't fit, then it's probably not ours, and then it falls into assurance that we need to find someone, some organization or entity in the community that it would be their primary responsibility or their primary interest to try to address that. That's that assurance factor. There's 10 essential services. I'm not going to go over them all. They're on our website if you're interested. So the second thing we do is we look at any of the services that we provide, whether it's providing some kind of a screening service to some kind of educational service or anything in between, and ask ourselves, does this fall within the 10 essential services of public health? Because if not, then it needs to go to an entity that does. So public health is really, I mean, it is very governmental, but it's also very protective of the community to make sure that disease isn't spread, that disease is prevented, that people are safe and secure. So at our health department, the next step is that we have what they call an I plan. Illinois is one of only about 5 states, a few more are adopting it now, that requires, as part of our recertification, every 5 years we have to be recertified by the Illinois Department of Public Health to be a functioning, viable health department and to be able to receive any kind of state funding that's allocated for public health departments. As part of that recertification process, we're required by state statute to conduct a thorough county needs assessment and lead the development of a county-wide plan for 5 years on how to address 3 to 5 health priorities that came out of the assessment. We had over 80 different community members involved in the process for developing the plan. We had 67 primary stakeholders in focus groups and 1,212 community survey responses to help develop the assessment piece of it this last time, as well as all the quantitative data on health issues among our citizens and what's really going on with them. There's 5 health priorities for everybody in Madison County, for you as individuals, for you as a Rotary, for you and your own businesses and in your own families to help address. And it takes every one of us doing our piece to try to make an impact on these health issues over the next 5 years. And the 5 issues for Madison County as a whole are teen pregnancy, obesity, substance use and abuse, air quality and environment, and mental health. And those are some pretty hefty problems, but it came out time and again between focus groups, community-based surveys, and the data all supported that. And then we had a group of 10 people from different sectors that impact health to help narrow down that particular list through some scientific number measurement stuff that we had to do. So as you think about what you want to do and where you put your energy as an organization, whether the one that you're here representing as a Rotary, as individuals in your own family, always go back to those 5, because those 5 touch every single person in this room every day from some aspect in this county, whether it's your pocketbook, whether it's something personal, whether it's an acquaintance, whether it's something that your organization deals with directly. I heard there were a few people here from churches. You deal with that kind of stuff with parishioners and within that community as well, from the business aspect. I mean, so if you think about it, it's whatever you can do, any little thing to try to help address those health issues. That's what public health's all about. We lead it, but we need everybody doing their part in order to really impact health issues in this county. There's only 38 employees, and we have 270,000 residents. So, 38 employees total at the whole health department. So it takes everybody in the community doing their part. If you want to read over the plan and the assessment, if you're interested in that kind of stuff, if you ever need data, I get a lot of calls at the office for data from people. All of it's on our website, and I've got a paper to give you that you can go directly to that link. I've tried to train our local media, and they've gotten pretty good at it. I can always tell it's a new person when they call because they don't know what it is or where it is. But the media has gotten very good about going there first and looking up stuff and then calling me with questions or a different angle or do we have anything new, you know. So I think it's been really helpful because the media in our community has even bought into it and helped out a lot. As far as the actual health department goes, as I said, we have 38 employees that run 5 different divisions. We have a public health administrator. Some of you may know her. Her name's Tony Corona. She grew up here in the Alton area. She does a fabulous job leading our department, and she does all of the administrative pieces, not just within the business, but also externally throughout the state. She's very involved in different things. From there, we have 5 divisions. We have an administrative division that are the accountants and the support service staff, the fiscal manager, that keep that business end of the health department running because it is business. You know, there is an aspect of that we have bills to pay and, you know, things that need to be processed, things that need to be ordered. We have the nursing division, which is known as personal health services, because it's personal, because they offer the individual kind of services. They provide immunizations, which is what most of you usually think of, childhood immunizations, but that's just one small piece of what they do. You know, they track communicable diseases in our community. We have an STD clinic now through that nursing division, if you will. That we see a lot of people through. They do foreign travel consults. If you're going overseas and you want to know what shots you need, You can get them at the health department. You can call and talk to one of the nurses. They'll identify what area you're going to, and they'll look up what are the latest trends there so that they can set you up. A lot of people don't realize the health department does that kind of thing. We work with another county entity on lead. One of the county organizations does the lead abatement, and we do the lead testing and processing and talking with the parents. If there's concern about lead being in the home, or if there's lead that's found in the home from an abatement issue, they do all kinds of stuff. We worked with parents of SIDS that had SIDS deaths from their children. We have a big HIV outreach project. I can't even think of all of it. There's just so much. So there's all kinds of immunizations available through personal services, but they have a wide variety of other programs. We have an Illinois breast and cervical cancer program. We get enough funding to pretty much cover just about any woman in the county that doesn't have insurance or has very high deductible insurance, between a grant from Komen St. Louis and from the state of Illinois, that we should be able to cover a woman to get a mammogram or a breast exam if her insurance doesn't cover it for her. The state's very committed to that. That's always been one of their big goals for the last probably 10 years. And Komen St. Louis has been a great partner because they help pay for who the state won't pay for, but they still can't afford it on their own. We have an environmental health services division. The first thing most people think of with the environmental health services division is your food inspections. And that's actually kind of what prompted getting the health department started, was people were finally paying attention to the fact that restaurants were not inspected, and hadn't been ever. So that was kind of that impetus for the county board to say, you know what, we probably need a health department, all those years ago. So we do have 4 inspectors, and that's what they do. There's 3 different categories of food establishments, and there's a whole schedule of, depending on what category you are, as to how often you get inspected a year. If there's issues or problems that come up, then we have sanitarians that go out and do further education with the facilities. They open and close the businesses, the different food establishments. They also do well inspections. If you need to dig a well, if you bought a piece of property with a well in it and you need it to be inspected to see if it's safe to use or find out what needs done, if you want to close a well, all that stuff goes through the health department, and a lot of people don't realize that. We have a county ordinance that regulates tanning salons and regulates tattoo parlors. Most people don't know that. So our environmental health staff, on a regulation schedule, they go out and they inspect tanning salons and tattoo parlors on a regular basis throughout the year to ensure that they're in compliance and that they're providing those services in a healthy, safe manner for the public, for all kinds of reasons why those two are kind of a hotbed of public health concern. We have the Smoke-Free Illinois Act in Illinois that went into effect January 1st, 2008. And I'm the coordinator of the program for the whole health department, but our environmental health staff are the ones that do the enforcement piece of that. So they're the ones that take the complaints, they're the ones that process the letters, they're the ones that go out to establishments, and we try our best to educate before we could fine, but we have had to fine, but not until we've done education, unless you see someone when you walk in, you can't do anything about it, you kind of have to do it. But they take care of that aspect of it as well. That's a state mandate that came down with that Smoke-Free Illinois Act, that we're one of the 2. Police departments and the health department are the regulating agencies of that, so either one can issue violations for it. And they do all kinds of other stuff, but those are kind of the big components of environmental health. They do, there's soil samples and water samples and all kinds of things like that that go on in environmental health. If there's a foodborne outbreak in the county, our Personal Health Services Division and the Environmental Health Division work together to identify where the source was, and educate and get people tested and get people on medicines if they need to be, depending on what that foodborne outbreak is. We also have an epidemiologist that's under our nursing division, and she tracks and monitors all kinds of things with the schools, with the hospitals, with some other key partners on a daily basis to watch for disease trends in our county, to assure that we catch something long before it becomes a big problem out in the community. So it's all about preventing, paying attention, staying a step ahead. We have the division that I supervise, which is the Health Education Division. We have health educators that do a variety of different kinds of education. Most of you think education is just a classroom presentation. That's usually the standard. We do that. We do all kinds of other things. We do a lot of outreach for sexually transmitted disease kind of outreach to let people know that we have a clinic, and to try to identify hot pockets of populations that need to know more about STDs. We do some teen pregnancy education and outreach at times. We do a lot of outreach with the breast and cervical cancer program. We used to have a prostate testicular program that we did a lot of outreach for. We have a bulk of the tobacco grant in my division, so we do prevention, cessation, and secondhand smoke, especially with disparate populations in my division. So there's all kinds of activities going on with that. We have a big Break the Habit program, which provides people that can't afford it with nicotine replacement patches, as long as they're calling the state quit line and checking in with us on this schedule as part of the program to help them quit smoking. And we've been very, very successful with that and increasing our quit rates in this county. We do health education campaigns. If you see billboards around the county or hear radio commercials, or you get something in your flyer in your mail with your newspapers and your grocery store ads is usually what we send it with. That's all from my division. Those are different ways that we promote it. We also are in charge of all of the website and social media that we've developed over the last year. So part of our job is to get that message out to you and educate you in any way possible, in any means possible. So it's not just doing a presentation, it's however we can get the information out to people that they're actually going to pay attention to it and possibly do a behavior change and do something with it. The last division is the Public Health Emergency Response Division. After 9/11, they finally recognized public health as a major partner in the effort for emergency preparedness. We were talking at the back table. Larry Ringering is the emergency management coordinator for all of Madison County. So him and his department are responsible for developing the plans and drilling and exercising the plans for the whole county for natural disasters or man-made kind of incidents. We're the public health arm of that, so we have a division called Public Health Emergency Response at the health department, and they concentrate on developing the public health aspect of those plans. If it's a biological or radiological, if there's an earthquake, what would be the public health impacts of it, or if it was a flood, so we develop the plans around the health aspects of the larger county plan. I'm the public information officer as well for the county, so I'm the one sometimes I'm the one that's in front of the media, but I'm the one that coordinates what are we going to do to get that information out in a timely manner, in a preventative way, and also in the time of a disaster or anytime we have something. I was on with salmonella a couple months ago. We had, when different things come up, I'm usually the one that gets the call at the health department to get the information out to you for what you need. So there's the information segment of the public health plan, and it all ties to the bigger county plan. So just reassured that we know what we're doing and we're prepared, but we need everybody to do their part too. For instance, this is Resolve to be Ready in 2012 is a new campaign from the federal government for this year out of the CDC. And if you go to ready.gov/resolve, it gives you all kinds of things, and that's what we're pushing this year. You each need to make your own emergency kit at home. Have your own emergency plan with your family. Develop a communication plan. How are you going to contact each other if there is a natural disaster or if there was some kind of a bioterrorism event? Where would you have a common meeting ground? What are the ages? Do you have a list of the medications that people take? Do you have backup of all of that? Those are all things that you as individuals have to be responsible for. We can't do that for you. All we can do is encourage you to do it in your own homes and in your own families and at your own businesses to have those kind of things in place and ready to go. And there's tons of resources on that website. It's one of the best ones that we use, actually. They seriously walk you through everything. They make it as easy as possible for the community. So we'd love for you to continue to interact with us. We are your public health department, so we're here to help support you as we protect the public's health. If you ever have any questions, you're more than welcome to call us. I'm going to pass these out for you. I've got a brochure with some overview of the departments we talked about, and our web address is on there, and I'm one of the website administrators, so I try to keep that as up to date as possible. We always have kind of that new interesting stuff on the front page, the Ready to Resolve link. Resolve to be Ready. I don't know why I'm getting that backwards today. I've been working on it all week. I put that up on the website yesterday, so there's links, and I even linked individually. Like if you want to know about how to develop an emergency kit, I created that link. If you click on that button, it'll take you directly to that part of the website, so you don't have to dig for it. We also entered the cyberspace world of social networking this year. So the health department is now on Facebook, so if any of you are on Facebook, you can like our fan page on Facebook and get updates from us. We also have fan pages for those health priority areas. We concentrate, like I said, on providing the core public health functions as well as the 5 health priority areas that came up from the needs assessment. So once you like our page on Facebook, look at the pages to the left, and those are pages that have to do with my staff are the ones that manage those pages on obesity, on sexual health and on air quality, and we still have to do the mental health and substance abuse ones, but those are on there as well. And they send out information specifically on those topics through those pages. We also have a YouTube channel with lots of fun videos, most of which are about hand washing right now, because we did a big project last year trying to promote flu prevention with 12 to 24-year-olds. So most of the videos on there are hand washing, but that's okay. It's not a bad thing. And we also have a Twitter. So if you're on Twitter and you want to follow it, I don't annoy people. I don't try to post more than one thing a day if I remember to do it that day. So it's the same kind of thing that we push it out. Whatever we push out through Facebook, we also send out through Twitter. Our hope is to get people used to this so that hopefully we never have an emergency, but if we do, it's a quick way. I get things faster through the CDC sometimes through my Facebook connection with them than even through the listservs that I'm on specifically for being the public information officer. So I'm hoping that more and more community members will like our Facebook page so that way, especially in an emergency, you can get that information firsthand. Because if it's a public health thing, more than likely you're going to have your electric devices and that kind of stuff. Hopefully. You know, if it's one of Larry's things, I can't guarantee you're going to have electricity, but hopefully if it's one of ours, that's not going to be a problem. So I don't know if you want me to pass this out here at the end as we finish up, or
actually they all have to leave through the door, so that's a good captive.
Okay.